hypertension or high blood pressure. It is the pressure or the force which is exerted during the contraction of ventricles over the walls of the arteries when the blood passes from ventricles through aorta into the arterial system. The pressure of the blood exerted over the walls of the arteries is calculated as blood pressure, and it is calculated by the mercury sphygmomanometer. It is a device, and the normal blood pressure is 120 by 80. The top is systolic blood pressure, the bottom is called as diastolic blood pressure. The range of the normal limit is up to 140 by 90. At this calculation or the limit, it is termed as start of blood pressure, high blood pressure. So when it exceeds 180 by 120 mm of mercury, it is a hypertensive crisis or the critical stage where immediate IV therapy is required to save the complication of high blood pressure. It is of two types, primary and secondary hypertension. 90% cases belong to primary. It is called as silent killer because the symptoms appears later in the age. It is a very prolonged procedure and pathology, and it is slowly developing disease. Usually the symptoms appear after 55 years. So it is called as silent killer. The symptoms appears in the later stages, while the secondary is produced by the other diseases, systemic diseases like disease of kidney, adrenal glands, obesity. These are other causes that produces hypertension in the human body. The cause of the hypertension is atherosclerosis. That is atheroma formation in the walls of the arteries due to deposition of bad cholesterol, fatty material, dead cells, and the calcium particles, due to which the vessels they become stiffened, rigid, hard, and the nerving of the lumen is produced, which produces the ischemia in the various organs of the body, like heart, kidney, brain, and the liver ones. Next is the sedentary habits, lack of routine aerobic exercise, high saturated diet. The saturated fat is responsible for this deposition and formation of atheroma in the vessel walls. Stress, depression, anxiety, excess of alcohol, and mostly the excess of smoking. Chain smokers, they are more prone to this disease, and that is why this disease is mostly present as compared to the females in the men, due to this smoking and over intake of the alcohol beverages. Obesity, lack of proper rest and the sleeping hours. So these produces anxiety, stress conditions, which are also responsible for production of the hypertension. Next, we come the symptoms of the hypertension. There is throbbing headache, lightheadedness, chest pain, dyspnea. Then there is edema of ankles and the feet, nose bleeding, insomnia, slurring of speech, palpitation, irregularity in the heartbeats, cardiac arrhythmia and palpitation, vertigo, tinnitus, and the other symptoms of the hearing system. So these are the various symptoms produced by the hypertension. Mostly 90% cases, they are connected with the primary hypertension, because this is a silent killer in the insidious process, slowly developing process, and the symptoms appear in the later life of the patients.